All right, you have made it back to the next video, and thank you for watching this because this is so important that you are able to do your scorecards correctly and we're able to move the process forward, and just that you feel confident knowing what these scorecards are and what you're going to be doing. So, what are your scorecards? Your scorecards are 3 health intake forms. That's kind of the basis of what they are, that are in Excel sheet format, so that they're a spreadsheet and they have specific fun things that happen where you can put in information and it adds things up for you, or it creates all these different colors and all these wonderful different things that we're going to be using to help just make working and looking at your progress and what's going on in your health currently so much easier. So I have a little joke there, Excel sheets to excel at information, because we are in stage 1 of gathering information and getting better information, something that your doctor might not take the time to do. So we are taking the time to do that. The 3 health intake forms have 3 different names. One is the metabolic chaos scorecard, which is why we call them all scorecards. We have an adrenal stress causes, which is another form of a scorecard, and the medical and health history, which is kind of like a normal medical and health history, but it's also something that we can use to continue evaluating moving forward. This is a hint of what they look like, and we're actually going to do a dive in real quick before we end the video so that you can see us interacting with the documents. But your metabolic chaos scorecards here at the front, and you can see at the top it says metabolic chaos scorecard, and there's information here we'll be filling out. And then the second one behind it is adrenal stress causes with the green headline, and the medical and health history is all black and white, and we'll also be getting to that. So some hot tips on how to finish your scorecards. Some key things to just keep in mind as you're doing it is, 1, fill out every section. And we're going to talk about what that means and what sections you are filling out, because we've just noticed sometimes people don't see a certain section, and it's really helpful if you're able to fill out every section, and we again don't have to email you back and say please fill this out, and then of course you have to open up your computer again and all that jazz, and we just don't want any of that. We also do ask that when you fill out every section, when you do this, please do it on your computer. It doesn't help us the way it works when it's all printed out, and so it doesn't utilize the Excel sheet the way it's intended to. So please do it on your computer with Excel, or if you have an Apple computer, with Numbers. Both of those work. Tip number 2 is to give yourself time. Just know that these don't usually take like 1 minute. They're a little bit longer. Take time to even use it to get to know yourself. How are you doing in the certain questions that are asked of you? I know the first time I did one of these was very interesting to me to even think, wow, how is my skin? How is my sleep? How are the things that maybe I don't think about as much? Because we are thinking about our gut or our constipation or whatever is going on. So give yourself time. Number 2, save it somewhere you can find it again. Because if you remember from our first video, every 3-month evaluation we do, you're going to be pulling open these scorecards again and refilling them out. And you'll see where we are going to do that. There's a specific place to do it, but that's how we're able to see improvements in a really clear-cut way, as well as in areas where maybe things aren't progressing or have gotten worse, which happens every now and again, but is usually a good reason why we retest or do more testing. And then lastly, when you do them, you're going to upload them to Practice Better right where you downloaded them from. So you get an email and it says, please finish these forms, and then you can download them and then you re-upload them into that same email. So now we're going to switch over, and I'm going to interact with these documents for you so that you can get an idea of what is going on with them. We're going to start with the metabolic chaos scorecard. Awesome. So this is what it looks like in Excel. It'll be very similar in Numbers. And here's where just want to point out where we'll be filling things out. So number 1 is your name. Please do fill that out. Your occupation, your height, your sex, and this is empty is metabolic type. We don't do that with everybody, so no need to fill that out. That is okay to leave empty. On the left side, though, we're going to enter the date, your weight, and your age. And you can see it says first test, second test, third test, fourth test. And that has to do with the number of times we've redone it. So when we first start working together, will have the date today, and then the second test, the date will be 3 months later. Your weight might have changed a lot. We have lots of clients who will lose pounds in the first few weeks and months of working together. It might not change at all, and that's okay, but we do keep track of that. And then your age. So if you pass a birthday, put down if your age has changed. On the right side, you can answer the questions here. What is your number one main health complaint? How often does this bother and affect you? And even though we've discussed that personally together, what it is helpful is that as we are reevaluating where your case, we want to know, where did you start, and making sure we don't forget those things, because if we've talked about it, unfortunately, I am not perfect and I can forget things. And honestly, we've worked with our clients, and a lot of times they end up feeling so good at the end of their process with us that they don't remember how bad it was at the beginning. So if anything, it's sort of like a time capsule. I hope you have fun. It's kind of cool. Just put down what you have put down, and it is helpful for us when we are evaluating your labs, because we don't just see your labs as pieces of paper that describe you. We really want to compare it to the information we find on these forms, which are really telling us a lot more about you and what's going on in you. Other things that you do want to fill out on this: if you're on any medications, that includes thyroid medications, any birth control like the pill, an IUD, anything that you're taking, acid reflux, anything that is prescription based that you are taking regularly, we do want on there. On the right side, supplements or anything, even if it's recommended by a doctor, it's not medication, but just anything you're taking for general well-being, for something specific, and the milligrams that you are taking is really helpful for us. And then the other area, and this is maybe the area that people most commonly don't see, is complaints. So when we started working together, when we had our 30-minute complimentary consultation, we talked about your 5 top complaints, the 5 things that are really bothering you. And some people only put down 2 or 3, but whatever you have here, that's just the top of mind big things that you're working with us for, that you are looking to improve. Those will go here. And then in the first test symptom scores, this column here, you'll put down on a scale of 0 to 10, as noted by here, where it says 0 is gone, 1 is very weak, 5 is average, and 10 is most intense, unbearable. So put those, you'll rate all your top 5 complaints on a scale of 0 to 10 here. And then every time you do a next test, you'll have second test, third test, fourth test, we'll re-update those numbers and see them slowly go down, or sometimes quickly go down. The last section in the metabolic chaos scorecard is the rest of the paper, and what it is a series of symptoms that are grouped by category. So here we have endocrine function symptoms, and these are something you'll be rating on a scale of 0 to 5. And here you can see the scale: 5 is severe, 4 is strong, 3 is moderate, 2 is mild, 1 is weak, 0 is not present. And so the first place you'll fill it out is in the past. And the past it does vary from person to person. Some people's past was 3 months ago, I was a happy human being and these were my symptoms. And some people base their past off of maybe 2 years ago or 5 years ago. Often it's the last time, like before they had a flare up, or the last time they remember feeling okay-ish. Or better, because we also know that sometimes illness and chronic illness can go in cycles. So we're not super picky about where you pick it, but I may ask you when we meet, like, what point in time did you choose to evaluate from? And what we are looking for is, some people, they'll jump from this wasn't a problem at all, like it was a 0 and now it's a 5, and that tells us something, versus maybe we'll hit a bunch of symptoms that are a 4 and now things are worse and they're a 5. So that helps us know what's been going on for a while, or how bad is it, or what's increased the most recently. So past is before today, sometime before today, and then now is today. So in the last few weeks, or whatever your current state is, how would you rate it? So chronic illness, like a lot of people here rate this a 5 by the time they're working with us, so 4 or 5. Bruise easily, bright light and sunlight bothers you, asthma, cold often crave salt. All these things are really helpful for us, and they teach us a lot of stuff about you, things that you might not even think of telling us. So that's part of the secret of these intake forms, is that we are asking you things, and we're asking all of our clients these things, and then getting details that it would A, take a while to gather otherwise, and B, might not be something that you would ever think to tell us, but could be really helpful for us understanding what's going on in your body. The next section on here is neural tissue health, and it's exactly the same past and the now. And then when we redo the test, it'll say second test, third test, fourth test, and that's how we see the differences. It's super easy and systematized. So again, important to save these files somewhere you can find them again on your computer. And if you do have a note or a comment, we do love those. They're really helpful. Like if you think like, sometimes there's skin related things like oily skin, you could say only on face, or oily skin wherever it is. Sometimes it could be specific things about it, when it started, or things that you notice about it gets better when blank. Some people put lots of comments, some people don't put a lot of comments. If there's anything that we do have questions on, we let you know and say, hey, we saw this here and wanted to clarify. Allison had a question about you rating this 4 or 5, and she wanted a clarification. And the next section is musculoskeletal health, carbohydrate metabolism, icosanoid and modulation, which has to do with your immune system, and detoxification capacity and fat and protein metabolism. Super fun stuff. The next document that we have is we're going to go over the adrenal stress causes. And this one is different, even though it still has colors and fun things like this. The adrenal stress causes instead is looking at what are potential things that are stressing you out. Not just, I've got kids, but things that are more specific, you'll see in the document. The other thing I didn't mention about the metabolic chaos scorecard is when you finish filling out these past and now columns, which you can see where my cursor is with adrenal stress causes, it automatically adds up your results at the top into these different columns. And so you can see maybe in the mental emotional category is the lowest, where the lowest amount of stress is, but maybe the highest amount of stress is environmental, and that can change. And then what we can see is every time we redo these numbers, what's changing. And sometimes we even find that something stressful happens, COVID or things like that, right? And yet because your body is getting so much stronger, that even though some of these are present, that maybe in the metabolic chaos scorecard, other symptoms are still decreasing. And that just means your body has increased capacity to handle changes and pressures in your life, which we're meant to have that. We're meant to have a capacity or a margin in our lives that when we experience something like maybe not sleeping enough or something stressful happening, that it doesn't completely throw us off. But when we're very sick and our body's not doing top notch, then smaller things can really bother our body. And so we'll get an answer here. This is a page that can be more helpful to see some notes and comments on. For example, acute stress or crisis. Sometimes that might be divorce or death of a loved one, or chronic depression, things like that. Those are options. And so sometimes us knowing a car accident in 2012, that was, an acute stress. Things like that can help us know what year was it, or what type of stress was it? Is it ongoing? Which we'll have an idea in the now category. Maybe in the past, maybe you've had years in your past that were a 5 out of 5 acute stress and crisis, just like all year long. But maybe now it's a 2, but realizing those years are still impacting you. So we just use all the information going on here. There's definitely no judgment, nothing wrong going on, but it helps us make sure we're covering all our bases and understanding you to the best possible. So when we are creating your protocol, we're having as much information as possible that can help us give you really intellectual or intelligent suggestions. So the first category is mental and emotional. You'll do the past and the now. Again, that's any time in the past. Environmental, the lifestyle, metabolism, and metabolism is the last section. So those all automatically add up, and that is that. Lastly, we have the medical and health history. Pull that up, the black and white document. And this one has to do more with diagnoses. So it might be like, if you're wondering, why do I have so many Excel sheets and what's going on? It's because you just have that, your health has that much information going on. Like your body and your life is a vast amount of information And it's hard for any one person to download all of it in one conversation. So we're saving our conversation time for some of the more fun conversations, some of the more personal things. And here we're just getting some of the nitty gritty down. We do ask that you fill out this top section again, just so that we make sure we have all the information that is most useful for us. And then here is where all these diagnoses are. A lot of them are diagnoses. Some of them are symptoms like reduced, I just saw appetite excess, appetite reduced. That's definitely not a diagnosis, but ADD or ADHD is a diagnosis. Sometimes you might sense that you have some of these things, and you can definitely put them down. If you're like, yeah, I do have grinding teeth, you don't need a diagnosis for some of these, but feel free to put them in. And again, there is the past and the now category, which is the same. And then we'll, of course, change them as we go through it. And again, some of these might be perceived problems. So other things to know with infections here, I know that there's a UTI one, urinary infection. And so if you know that maybe once a year or multiple times a year you're getting UTIs, that's going to make the number, it's not always how intense these things are, but sometimes also how frequently you're getting them. So if you're like, wow, I get a sinus infection every other month, or you have chronic sinusitis, you could put this at a 5. Like, that's an intense thing. We don't want you having a sinus infection every other month. And so it might be something you'd put 5 out of 5. And then, of course, as we progress in healing your body and your body being able to heal itself, we'll expect to see those lowering so that you get them less frequently, or they're less intense when you do get them, or they last longer. So on a scale of 0 to 5, we always consider intensity, how intense something is, duration, how long it lasts, and frequency, how frequently you get any one thing. And then at the very bottom, we just have a bunch of X's. Do you have this? Do you have that? And then some questions. What time do you normally go to bed? This is a really helpful section for us, just so we get an idea. And you can feel free if you say, I go to bed at 10, but I can't fall asleep till midnight, put that. You don't need to say midnight. Definitely give us more detail. If it's relevant, the more detail can be helpful. When is your energy best during the day? All these different things. Your chronic pain, heritage, prescription medications, and over-the-counter drugs. And again, this is just an easy way for us to review if we're looking at diagnoses above, making sure we have all the medications and over-the-counter drugs that you use. Even though I know they're on another sheet, it just helps us with all of our information. So that is all of your information regarding your labs. Or your scorecards, which you can easily do. I highly recommend doing them before your labs arrive, because once your labs arrive, you'll be focused on your labs. So in the meantime, we do recommend you fill out these scorecards, get them back to us. You can do it in an evening, you can do it in an afternoon, you can do one per night, whatever works for you. Get them back to us and practice better, and then you will be done until, of course, we reevaluate, which is its own fun time. So excited. Thank you for listening to this video, and we'll see you in our next video dropping into your email.